My name is Dr. Ayee-Marie Mcgrath. I'm co-principal and owner of Knightsbridge Dental Care. I've been a practicing dental surgeon for about 13 years. And in that time, I've worked in absolutely every branch of the profession. I've worked in the army, I've worked in the maxillofacial head and neck cancer unit, I've worked with terminally ill children, and I started general practice in probably one of the poorest socioeconomic areas of London, and I now practice in one of the most affluent. It may or may not surprise you about how similar both of those places are. It's taken me this long to be able to own the dental practice of my dreams and to work with the dental team of my dreams. I feel that what I get to do on a daily basis is so unique and that I'm in such a privileged position, because every day I get to do something that's beyond myself. It's not about me, it's about how I make other people feel. I get the opportunity to take people's pain away and heal them. I have the opportunity to remove very deeply ingrained fears and phobias. And I get to really listen to people and hear things that they probably haven't told anybody. But with this privilege comes the greatest of responsibilities, because people hand me and my team the decision-making capability, and in doing so give away their ultimate power. But I've come to realize that it doesn't matter who's sitting in my chair, whether they're a billionaire oligarch or a housekeeper. They're all human and they're all as vulnerable and as equal to each other. And in their need for oral health care, they end up opening their hearts and their minds to us. My team and I, we know and we understand that the majority of the health issues that people present to us with is very deeply and intricately linked to their mental and spiritual well-being. And our greatest challenge and responsibility is to make them really understand and see that link, and not just treat clinical problems in isolation. And here is where we daily see a fundamental disconnect. Most patients, most people are disconnected, disassociated from their own bodies and what's going on in them and why. The greatest of clinicians are those that can put the whole back together. This is what makes my profession challenging but exciting. It's what motivates me every day, and it galvanizes my team every day. So we're qualified clinicians, but you know what? We don't always have the perfect answers for everything. We don't know everything. Sometimes we just don't know. And people come to us with the highest of expectations. They expect us to have like a godlike omnipotence. They want concrete answers and quick fixes. And sometimes we can't give that. But it's not because we're not capable. It's because we have to be humble and remind ourselves that the human body and the human mind is the most complex, most dynamic, most unpredictable living entity on this planet. In order to help us understand, we refer to a whole raft of modern technologies and scans, and we try and find solutions and reasons that can't always be found. So we learn to take a step back, to consider the patient as a whole, and look beyond often what's in front of us, really listen and empathize. And here's where we get to the real nub of the problem. This is when patients outpour often their hearts to us. They tell us about their marriage problems, relationships, divorces, abuse they may have suffered, their stresses and strains, financial or otherwise, eating disorders and their deep self-hate issues, and their darkest secrets. And then we carefully try and nurture them and their understanding as to the source of their physical problem. A good clinical example I can give you is the condition of tooth grinding, which is on the increase. This is a deep, subconscious mental stress response. It's a stress reflex. And it can be so severe that people will wake up with headaches, will have jaw pain, shoulder pain, neck pain. And very, very severe grinders can peel their teeth off one by one. The teeth will become devitalized. It would be futile just to treat the teeth and treat the pain without getting to the nub of the problem. So every day I get to watch, sense, and really live that link between oral health and spiritual and mental well-being. And it's really important the decisions and the management decisions we take can really affect the quality of our patients' lives. So who am I? Am I just a dentist? No, I'm a counsellor, I'm a psychologist, I'm a care provider, I'm a nurturer, I'm a shoulder to cry on, a place to release, I'm a healer, I'm a friendly face. I like to think that the approach of our practice is particularly unique because alongside the traditional dentistry, we provide a real emphasis on mind and body. Where we can, we use holistic approaches and we reinforce this with massaging techniques, aromatherapy oils, musical therapy, to provide modern, tailor-made, pain-free dentistry. We can't forget that, as Gal said, well, not just dentists wanting to kill themselves, but most people hate the dentist, and coming to the dentist is one of the strongest phobias that there's ever been. And it's because you're relinquishing control of a very private part of your body. But step by step, with patience and with the right care, we can break those barriers down and deliver pain-free treatment. We recently had an 11-year-old girl who needed a really infected tooth taken out. We spent about 2 hours trying to talk to her and coax her into having the treatment done. And what really came out was her eating disorder and the fact that she was being bullied so badly at school. It's these journeys and these cases that teach us a lot. And we learn a lot about ourselves in the process of treating others. My greatest personal challenge, my Mount Everest, is tackling the perception of what an implant surgeon or a dental surgeon should look and be like. Implant surgery is probably still one of the most male-dominated fields in our profession. I don't fit that stereotype of the greying male wise clinician. And I've had, sadly, patients refuse to have treatment by me because of their perception of my age, because I'm a woman. But I hope, and what me and my team work hard to achieve, is that in the end, they see that yes, I bring a femininity, a lighter touch, and an intuition that can be lacking in the profession, and these are assets to be embraced, and that they should give me a chance. My biggest dream is to work on those perceptions and help to change them, to challenge them, and provide a real platform for future female surgeons who are coming up so they can flourish and excel. I like to take my holistic dental mind-body approach and develop this philosophy and reach as many patients as I can. I love the fact that my job humbles me. It teaches me valuable lessons on what's important. I want to continue to strive and be better every day. Recently, we diagnosed a young father with Hodgkin's lymphoma. I couldn't help but think, what if he hadn't come for his dental checkup that day? Cases like this remind me that there's no greater gift than the gift of health, and that me and my team are so privileged to be able to contribute to that in any measure. That's true fulfillment to me. I recently read a quote which really stuck with me by Professor William James of Harvard University. And it said, compared to what we ought to be, we are only half awake. So I'd like to leave you with this evening. How does your spiritual and mental state of well-being affect your physical health? And how often do you stop to connect those dots? Thank you for listening.